Hi everybody, Jessie here. Today at IBS Dietitian Office Hour, we're going to talk about a report that came out last month by AGA, American Gastroenterological Association. All right, I see that Brooke is here. Let me bring her on. Okay. We'll talk about reports from AGA that shared some updates and statistics on IBS patients. And I think this is really good information for everybody to have, to hear about, and also understand that you are not alone with IBS because IBS, hi, hi everybody. IBS is very debilitating and also oftentimes feels very lonely because of the invisible symptoms of IBS. Now, I do have to say this real quick. This session is sponsored in part by Ardelax. Their support helps us provide education resources to the IBS community for women. Please note, all information shared is for educational purposes only and is not a substitute for individualized medical advice. Always consult your healthcare provider for personal concerns. All right. Oh my goodness, we have so many people joining us on Instagram. Let's dive into the data. Okay, so this report just came out in August, and it's one of the bigger IBS surveys that have ever been published because there are over 2,000 IBS patients, about 1,000 IBS constipation patients, about 1,000 IBS diarrhea patients, with 300 primary care providers and 300 gastroenterologists. So it's really one of the bigger studies. And what they wanted to study was the impact of IBS on patients' life. Yeah, Brooke, do you want to say that first line there, which I think everybody can really resonate with?
Yeah, so the survey finds that IBS symptoms interfere with patients' productivity at work and school for nearly 11 days per month on average. That's a huge impact on people's lives. It also, in addition to symptoms disrupting personal activities, 8 days per month on average, which is highlighting the substantial burden of the condition.
Right.
And you're missing a lot of days from work and school for GI symptoms, which is really sad.
Yeah. Yeah, and altogether, that is 19 days in a month that IBS is interfering with your life, right? Personal and professional. And I think one of their big statements here is patients' ability to accurately predict symptoms remains elusive, impacting their personal and professional life, which again, 19 days out of a month is a lot. And it actually increased compared to 2015. So they did this surveys in 2015 as well. I think at that time, IBS symptom impact. IBS patients today are missing 3.6 days of school and work per month. And in 2015, it was 2.1 days. So now we are missing at least 2 more days compared to in the past. I think too, maybe because we have better surveys that are asking people, not that IBS have gotten, well, potentially IBS have gotten more severe because we just came out of a pandemic, which we know through the pandemic, a lot more people got diagnosed of IBS as well. So maybe that have some impacts, but we don't fully understand the increase, but we know that it is interrupting more work compared to what we know of in 2015. Less than 1 in 3 patients feel that they can very or extremely accurately predict whether they will experience symptoms today, which hasn't changed since 2015. So back in 2015, it was 29%. Now it's 31%. So
Yeah, that's what we see a lot.
Yeah.
We see that a lot in our clinic. People just, you have to look for bathrooms. You have to, interrupt your life, because you never know when the symptoms are going to hit. So that's part of the reason this is such a debilitating issue, because you don't know when things are going to happen. If you could just get it done and move on with your day, that would be great, but it doesn't often work that way.
No, and also in the report, it says 77% of IBS patients avoid situation where bathroom access is limited, which we hear so often. Like, people are afraid of even driving to work if there's no bathroom on their way to work. Like Laura came onto our podcast, Dr. Laura, who is a healthcare provider herself, who experienced a lot of diarrhea. Her drive to work is on a bridge. That's a flyover bridge on a highway. There's no exit. There's no bathroom. And just driving to work, she's so anxious whether she would need the bathroom or not. And like you said earlier, a lot of patients that we work with in our clinic say that they have to bring spare clothes. They have to bring wipes. They have to bring napkins to wherever they're going, just in case something will happen, right? So if that is you, you are not alone, and know that you don't have to struggle. Work with your provider to find a solution or create a management solution. All right, 72% feel their symptom caused them to stay home more often. Oh my goodness. I feel like this is probably everyone with IBS, and ourselves included, right? Because we have experienced IBS ourselves. It's well managed, so it doesn't limit what we can do nowadays, but we hear this so often. People have to stay home because they don't feel well, or because they don't know whether they're going to have, flare up that day. Okay. Now, and then there are these numbers here. I don't know if you want to read it. It's living with IBS impacts patients' personal identity and sense of self-fulfillment. Oh my goodness. Now, these numbers are pretty debilitating, and also says, to us too, how much IBS affects a person. Did you find that there?
No,
Yeah.
which...
Okay, I'll read it. So it's this part on the handout. So 72% don't feel like themselves because of their symptom. We get it. We hear it all the time. And I have been, both of us have been there. And for me, as an IBS-C patient, right, when you're very backed up, it's the dull pain, it's the bloating, it's the constant discomfort that really drains your energy away. And we hear that from patients a lot too in our clinic, is that I don't feel good and I'm so angry all the time and so irritated all the time because I just don't feel good. And it makes me, sometimes we hear patients say that not a good partner, not a good parent, and not a good coworker because I'm so grumpy. If you feel that way, you're not alone. We've all been there and we know how it feels. And, the pain is very real. All right. 69% say their symptoms make them feel like they are not normal. Oh, yeah. We hear this a lot. And I think a lot of the times, we don't want to we don't want to, how should we say? We don't want to say that your symptoms, we don't want to downplay symptoms. If you have extreme symptoms, you have to speak up. You have to advocate for yourself. You have to talk to your provider. The key is really to document all of your symptoms, bring it with you to your session so that they better understand what is going on. But I think, make them feel like they're not normal. That is so common because a lot of the times when you're feeling so uncomfortable, so sick, or have a lot of diarrhea, people are convinced that they have something way more severe than IBS, right? And we hear that a lot. Actually, many of our clients came onto the IBS Nutrition podcast, talked about that. They're so certain. Now, if you have very severe symptoms, please do document your symptoms, bring it into your providers, get the right test that you need. Oftentimes, physicians will order blood work, stool test, and scopes if necessary, and they're looking for multiple different overlapping conditions. oftentimes, if you are newly diagnosed with IBS, oftentimes they will just test you out of celiac disease and inflammatory bowel disease if the symptom match. But if you keep advocating for yourself, you can probably get more tests that may be necessary, because there are a lot of GI conditions that have overlapping symptoms with IBS. So it's not just testing out of celiac or inflammatory bowel disease, but potentially testing out of things like bile acid malabsorption, exocrine insufficiency, or maybe even SIBO or abnormal growth. If you have, more IBS-C or IBS mixed bowel type, always advocate for yourself, always ask for more tests. Because once you get those tests done, right, you're going to feel so much better. Now, if all the tests come back normal, also don't feel discouraged, because that is how you get an IBS diagnosis, that you don't have another condition, right? But oftentimes patients feel like, my doctor just, written me off because everything is normal. In the moment, it can feel like they're writing you off, but it is actually a really good sign that everything is normal. Because if something else comes back as positive, then you have a disease that actually causes damage or causes inflammation in your GI tract, whereas IBS does not cause inflammation or damage in your IBS. And when it comes to IBS, there are medications that can help, there are diets that can help, and there are lifestyle changes and gut-brain connection exercises that can really help. So don't feel discouraged if you get one of our patients came on and said that what is that, blank slate of health? No, how did Kim say it? So
Clean slate? Was it a clean slate?
Oh, clean slate of health. So one of our clients, she came on our podcast. Her name is Kimberly. And she is the daughter of a physician, and I think she's got other medical providers in her family. So she's very keen on, getting all the tests, advocating for herself. How many GI did she go to? She went to 3 different GI, I believe.
I think so. Yeah.
Yes, and she said, all tests were normal, and she was. And she said, I have a clean bill of health. Oh, yes, that's what she said. And yet she does not feel normal because of all the symptoms that she was experiencing. So if that is you, don't feel discouraged. Continue to work with your provider, because if it's IBS, there are treatments out there that are evidence-based, right? Diet and lifestyle changes, that's what dietitians are for. We're here to guide you through necessary changes to your diet or modify your lifestyle to help you keep your symptoms at bay. And there are also medications that can be helpful for pain, for constipation, for diarrhea, right? But there are, I would say you have to trial it with your provider to see what works for you. But the ones on the market that are prescription grade, they work, they have evidence to say that they do work. But work with a provider to find the right one. I think in the IBS community for women, somebody said she is on a prescription medication. It starts with an L. I think she says she's on Linzess. It's not very helping much. In those cases, Linzess can take 1 to 2 weeks for it to fully work. Stay on it, talk to your provider to see, how long should you wait before you would see symptom relief. Talk to your provider, understand, what the expectation is, how long does it take for it to work. If it doesn't work, go trial something else. Ardelyx, who is sponsoring this episode, they have a medication for IBS constipation that can be helpful for some other patients. So, talk to your provider. There are so many options nowadays. There are many prescription medications for IBS out there. So talk to your providers, try them out. Each medication can be targeting a particular symptoms or sometimes multiple symptoms, right? There are some that can help with gut motility and reduce pain. There are some that can help with reducing pain and managing diarrhea. And some of it helps in lowering the gut hypersensitivity. So there are so many different options, but talk to your provider, make sure you're documenting your symptoms in a way that can help you monitor, help you understand whether it is working or not. We have a free symptom tracker on pooppedia.org. Go download it, print it out, use it to track your symptoms. It is pooppedia.org/resources, POOPEDIA.org, O-R-G. Or if you are finding me on, if you are finding this video either on Facebook or Instagram, if you're on Instagram, you can send me just the word symptom or comment symptom on any of my posts. I will DM you. I'll ask you 2 questions. One is your name, one is your email address, and we'll email it to you. So that's our symptom tracker. It is extremely useful to track your symptoms to better understand your body, right? So that you know what may be going on. You can convey your symptoms more accurately to your physician. And when you are trialing different treatment options, you can better understand if it's helping you or not helping you, and how much of the symptom improvement are you seeing, so that you can, when you go back for your follow-up appointment with your physicians, you can say it precisely. Mm-hmm. Yeah. Anything you want to add to that?
Just to kind of reiterate that if you try one medication and it doesn't work, don't give up. Go back to the doctor, say it didn't work, clarify which part didn't work, which, if the medication helped in any way, and if it didn't, ask them what's another medication you can try, because every medication is gonna work a little bit differently for each person. There's also different doses. You have to be drinking enough water with Linzess and medications like that. So just make sure you're covering all your bases, but don't give up if one medication doesn't work. And because it can be, what we find a lot too is there's not one answer to kind of manage symptoms. It's usually a lot of different lifestyle, diet, possibly medication. So it all needs to work together, and it can take a bit of time to get the puzzle all sorted out. So don't give up hope if trialing one thing doesn't necessarily help right away.
Yeah, I'm also seeing some questions on our Instagram page. We will get to Q&A toward the end. We'll go through the survey first, and then we'll go to that. And in the survey, it also talks about treatments for IBS constipation and IBS diarrhea as well. So last thing one of the last numbers on here is 69% of patients feel their symptoms prevent them from reaching their full potential of being successful. For those of you who are listening, do you agree that your IBS symptoms are preventing you from living your life to the fullest? That's something, we hear all the time.
Yeah.
Yeah, I think one of our clients that we talk about a lot is Kinsey, who is a dietitian herself. Like when she started working with us, she was afraid of even being in a car for 5 to 10 minutes, worrying that she would need the bathroom, and because it's happened before where it makes her extremely anxious. Toward the end of working together, she was able to pick up her dream job, which was about an hour away from her house, and she was able to drive to work without worrying that she'd need to stop to find a bathroom. So IBS really does impact somebody in multiple ways, right? And for those of us who have IBS, we know when you have that constant discomfort and irritation, you don't feel well. You don't perform well, and it's really making us less likely to reach our full potential. Oh, and another thing is sometimes it affects our sleep because of the discomfort, right? That's something we hear a lot. And we know when you're not sleeping well, nothing functions well. So that's another thing about IBS is you have to make sure you're sleeping well enough, because that supports your overall gut-brain connection, and it lowers your stress level, because again, stress is another trigger for IBS. For me, especially, that is one of the big triggers is sleep and stress. All these, right? Oops, sorry, my camera just flaked. But all of these things, right? We really have to understand our body, create a routine that works for us, and really help us improve our IBS. If it's constipation, then what we need to do is to have a routine, to have full evacuations every day, which we're going to get to treatments in a little bit. And then also if it's diarrhea, then understanding what is triggering your diarrhea. There are so many different types of diarrheas out there with IBS that is all lumped together under the umbrella term of IBS diarrhea. The reality is, if you don't know what's causing your diarrhea and what type of diarrhea you have, it is hard to stop it. And once you know, then you can stop it for good. And that's something we see often, like in our clinic, we have seen what? Bowel acid malabsorption, not so much exocrine insufficiency, but that could be another potential IBS diarrhea. We see a lot of food intolerance-induced diarrhea. And sometimes we see overflow diarrhea. So all of these have different, I say, quote unquote, root cause. And if you don't know what is causing it and you're just piling on different supplements or restricting food when they're not your food triggers, then that may not be helpful. It causes more confusion. It makes it more difficult to treat your actual IBS diarrhea and the root cause of it. Okay. Now, let's talk about treatment satisfaction. I think this is something we can celebrate a little bit. Mm-hmm. So, modest satisfaction with treatment effectiveness and availability coupled with a patient-provider disconnect regarding RX treatments highlights opportunities to improve patients' quality of life. Okay, I think that is a very hard to understand questions. But it says modest satisfaction. And the reason why it is modest, because there is a huge improvement compared to last time, a huge improvement as in it doubled, right? In 2015, only about 1 in 10 patients were happy with their treatments. In 2025, 1 in 5 patients are happy or are satisfied with their current treatments. So yes, so comparatively, it was 10% before, now it's 20%. So that is an increase. Are we doing good enough here? No, we're not doing good enough here. There's a lot of room for improvements because we do ideally want 100% of IBS patients to be happy. And I think the gap though, as a dietitian, this is my opinion and only my opinion, with IBS, right, there's nothing organically wrong with your guts. There's no inflammation. There's no damage. You know, diet and lifestyle and some medication can be very helpful. But it is hard for a physician to find time to talk to you about the dietary changes that you need to make or the lifestyle changes that you need to make. And we know, working with a lot of people, that making diet changes or making lifestyle changes is extremely challenging, right? It's not something, I give you a list of 10 things to change that you can change overnight. It really requires a lot of support, a lot of reinforcement and accountability and structure to make those changes. But now, as I'm saying this, if you've been recommended an elimination diet, right, the key is not just eliminate, the key is to add back so that you understand what is causing, what foods are triggering your symptoms if you do think there is a food trigger. Okay. But anyways, we still want to celebrate the small wins. That is the 10% increase in patient satisfaction from 10% in 2015 to 20% satisfied in 2025. Yeah. You want to add more to that or maybe talk about the breakdown of satisfaction? I think it's actually pretty the same across the board between IBS-C and IBS-D. I'll put the thing here so you can see. Oops, can you see? It's not focusing. Backwards. Oh, is it backwards? Okay, sorry guys. But anyways, about 50% of IBS-C and IBS-D patients are somewhat satisfied. About 25% are very satisfied. So that is an improvement, right? We can't do better. All right. 1 in 2 physicians believe the availability of treatment option is what is most lacking in IBS treatment today. Up 15 percentage point from 2015. Oh, so in 2015, about 34 physicians believe treatment option is lacking, but now it's 50% of physicians say that treatment options are lacking. That's a bit backward, but it's a good thing, right? If they are realizing we have a limitation in treatment option, then it may potentially go into more funding for research into IBS treatments and IBS. I don't want to say the word cure because you really can't cure IBS.
Mm-hmm.
And the interesting thing about IBS is that it is multifactorial. Everybody have different causes to why they have IBS symptoms. So there wouldn't be one treatment or one cure that can cure all of your IBS because everybody is different. There's people having constipation, there's people having diarrhea, and there's people having a mixed type of dose, you know. So I think, yeah, but hopefully it can translate to if physicians think that there's a lack of tools or treatment options in managing IBS, that can translate into more exploration to different tools, right? And I think too, as a dietitian, we both know that referral to dietitian or psychologist or pelvic floor therapist are not optimal, right? If we see patients with pelvic floor dysfunction, then we definitely want to bring on a pelvic floor therapist to help a patient. If we see a patient being extremely anxious, or there is a negative feedback loop when it comes to, you know, their anxiety level or gut-brain connection, then we want to bring on a GI psychologist to help manage that part of the symptom. And of course, for people with dietary changes, well, suspecting food trigger or need to make dietary changes, then the key is to having a dietitian on the team and really guide the patients through the elimination diet step by step so that people don't stay stuck on the elimination phase of any diets, right? And that's something we see all the time. And it's really not great for IBS, even if it's just a low FODMAP diet, because we know the more variety of food you consume, the better for your gut microbiome. And that is also key to managing your IBS in the long run. So I think, you know, if there is more awareness in the lack of treatment availability, then maybe that will translate into working more with allied health professional. And that's what we call ourselves, like dietitians, physical therapists, psychologists. What else? I think maybe even like a primary care physician, right? A GI would be the main person leading the whole thing and bringing in everybody, or sometimes it might be the primary care physician facilitating all of this. What often ends up happening is the patient coordinating their own care and gets overwhelmed. And in our clinic, we kind of facilitate as that role as well. If we see a red flag, for example, if we suspect somebody may also have endometriosis, we send them back to their gynecologist and also help them find a gynecologist who might be more specialized in endometriosis. If somebody needs a new GI, then we help them, you know, look for a GI. We also help them write notes to their GI if there are tests that we think they need to get just to cover all bases, because there are a lot of overlapping conditions with IBS. And sometimes, you know, it is in the details of the symptoms, how symptoms show up, and whether you're responding to certain treatments or not. Then in those cases, we really need to look at other potential problems. Anything to add to that?
I do think that, you know, I'm over 50, and I think way back in the day, which maybe not too long ago, when you went to the doctor and they decided you had IBS, they kind of then wrote you off and were like, it's all in your head. So I feel like now with more education, doctors may not, you know, maybe some of the improvement in, you know, care from doctors is that they're not saying that anymore. They're really trying to help you instead of just saying, oh, it's IBS and sending you on your way. I'm sure some physicians might still do that, but I think a lot more now they're more willing to listen to and not just write you off that it's IBS, basically go away. So I think they're with the medications that are available, they can help a little bit more instead of just writing patients off and dismissing their concerns and their symptoms.
Yeah, that's a really good point. And, our friend, Kate Scalata, she had a campaign. It was called I Believe in Your Story a few years
Yes.
ago. And I was thinking about that today. I was like, patients have to suffer for a long time before they get the proper care. And diagnosis time is about 6.5 years. Actually, there's no update on that in here. Maybe you will. No, I don't think there is an update because it takes a long time, because in the past, physicians didn't believe it. And a lot of physicians back in the day say that IBS is not a real diagnosis. Diagnosing criteria has also changed. Now we follow the room full criteria, so that helps in getting a diagnosis faster, instead of like, oh, you have to exhaust all of the tests, right? Mercedes, one of our clients, came on and said she saw 4 different GI, and the 3rd GI finally gave her an IBS diagnosis. And I'm like, why did it take so long? And that was like years, right? But don't give up. Do find somebody who will work with you, who will listen to you. And if you do have IBS, or if you are still seeking a diagnosis, look for IBS specialists in your area. But make sure these specialists are actual gastroenterologist or dietitian who specializes in this area. Now, dietitians do not diagnose, but we can help you get you to the right diagnosis faster. But find a GI that specializes in IBS. That is that can help you speed up your diagnosis a lot faster and really help you feel better, or maybe at least help you get to the proper treatment faster.
Yeah.
Okay, last thing, treatment, prescription treatments disconnect. What is this? Okay, 60% of both IBS-C and IBS-D patients have tried FDA-approved prescription medications for IBS. Say they are among the most helpful treatments. And what is the disconnect here? However, patients reports that healthcare providers predominantly recommend over-the-counter medication and lifestyle changes. This is good to know. Okay, patients reported top recommended treatments by healthcare providers. Do you want to talk about this?
Yeah, so for IBS-C, 30%, is this the patients that are saying what the...
Yeah, so the patients are reporting what treatment they received.
Okay, so the patients, 30% say fiber, 26% say non-prescriptive laxatives, which would be something over the counter, stool softeners about 24%, and lifestyle changes like exercise 24%, and that's for IBS constipation. IBS diarrhea, diet changes 26%, so that would be kind of figuring out what your trigger foods are. Over-the-counter medications for upset stomach or diarrhea 26%, and probiotics 25%. Which the probiotics part might be a bit problematic.
Yeah, probiotics in our clinic, what we see is probiotics causing more problem, especially when it comes to diarrhea, than not problem. But everybody's again different. There are certain strains that can be helpful, but most of the probiotics on the market may not be helpful. Like, they don't do nothing. That would be the best, but oftentimes they make symptoms worse, especially when you've been on it for prolonged periods. It can cause other overlapping conditions such as bacterial overgrowth. So that's something to be mindful of. And that is the IBS in America 2025 survey. If you want to read more about this, you can Google IBS in America 2025. This is published by the American Gastroenterological Association. Okay, and we have some comments and some questions here. Let's pull it up. Well, somebody was asking about our programs. So this is somebody who already have our self-paced course. So we offer 2 programs, two forms of help from us. One is working with us directly, that is in the IBS Freedom Program. And then these this person is asking what is the difference between that and a self-paced course. Our self-paced course, you don't get direct interaction with us. You have the material to the videos, the workbooks, the recipes, everything in a course format. So there are 6 modules in a course, and there are videos, there are multiple videos in each module. They're short videos, so they're easy to digest. That's always the goal, right? It's easy for you to learn. And there's workbook to help you work through the course and kind of work through what we do with our clients when we are working directly with the clients, but without our direct support. However, you do get a Facebook support group, which is private. And then also we do every month we do a Q&A session with me directly. And we just did one today, actually. Somebody joins the call, and I love to see members join the call because I can answer your questions better. You can ask your questions multiple different ways. So that is our self-paced course. And our IBS Freedom Program, that is our small group program. That is our VIP small group program, and that we are currently enrolling. Enrollment ends next Tuesday. We only have about 4 spots left at this time, and that course is you work with us directly for 4 months. And what do I mean directly? That is, you have 14 sessions with us. 2 of those sessions are one-on-one sessions. You start the program with one-on-one sessions, and then in between the program, we meet another 12 times in small group sessions. So every week, basically we see you every week for 14 weeks. And that is, in our opinion, how long it takes to get through, eliminate the low FODMAP diet at least, right? And then also if there are other overlapping conditions, we use the time we're working together to investigate what else is going on to help you resolve the root cause of your IBS, what is causing all of your symptoms. And we also bring in, treatment options, talking with your providers, because some of the more severe cases, right, we're definitely writing to your providers, and we sometimes refer out to GI psych, sometimes we refer out to pelvic floor therapy, depending on what symptoms you have, which is what I said earlier. We kind of work as a, what do you think, a caseworker for your case, because we know your case so well. In that, while we are working together, another thing our patients, our clients get is you get to document your food intake in the journal in our electronic medical record system. You can upload your food intake, your fluids, your symptoms, and more importantly, your bowel movement pictures for us to see. So we can get a full picture of what is going on and help you move in the right direction. And that could be in terms of dietary changes, challenging food, reintroducing food, and seeing if any food is causing you symptoms. Of course, that's the number one thing people come to dietitians for, but we do a lot more than that in our clinic. So that is working with us in our IBS Freedom VIP group program. Every group is limited to about 4 to 6 people. Once we fill up those spots, we don't open them again. So the current group is our last group for 2025. We'll open it again for 2026, but we'll most likely, due to inflation pressure, we'll have to increase our prices because everything we use is increasing their price. So that's just a bit unfortunate. But yeah, does that answer your question? So one is working with us directly, one is a course-based. The course-based, of course, is extremely affordable. It's our goal is to help as many people as possible because we know not everybody have access to GI-trained dietitian or IBS-trained, FODMAP-trained dietitian. We want to be there for you at a very low cost so that you can, have access to our help. But working with us directly in the small group program, that's where we see, I would say, probably 99% of our patients improve their symptoms within that 4 months drastically. Most people have a 180 turnarounds, right? Some people have a slightly longer, what they will improve, but they might not be 180 turnarounds. So working with us directly, I think, is that professional guidance in regards to your own symptoms. Brooke, do you have anything to add to that? I'm like, blah, blah, blah at this point.
I do think that pointing out that it's not, we just don't interact with you in the group. It is the journal, like Jesse said, but we're also have a messaging platform and are reviewing those journals several times a week. And you have not 7-day week access, but many days a week. One of us is checking on journals, checking the messages, and responding to people quickly. So it's a lot. It's a much more you get direct contact with us, but we're also like hand holding. It's a very supportive program. And then you get the other group members, which you still get one-on-one conversations with me, but you also get the support of other people that are going through what you're going through, which is and you can crowdsource in the chat for, different recipes or things, what have other people found works well for them. So that's super helpful too.
Yeah, I forgot about that. Our group, even though it's a small group meeting, it's like a mini one-on-one session, but you get to hear other people's mini one-on-one session. And during the group, we really look through actually, Brooke and I meet every week to go through all of our patients at one time. And Brooke checks the journal on Monday and Friday, and then we meet on Tuesday. And then the meetings are either on Tuesday or Wednesday. So you are getting 2 dietitians checking your journal and checking your progress at least 3 to 4 times a week and giving feedback. And the thing about GI condition is that changes happen very rapidly. And sometimes people get afraid, and having that feedback is important. Or sometimes we see that, hey, you are good to challenge this food or to reintroduce this food. Now your symptoms at baseline. It may not have happened when we had our group meeting on Tuesday, right? But when we checked your journal on Friday, we're like, hey, how about you do this on Friday, this weekend? We think you'll be okay. We think, this is a good time to challenge your food. We go in, and what helps us make those determinations on when to do what is looking at what symptoms you have, because our patients are documenting their symptoms, right? And they're also uploading their stool pictures for us. And one of the things, I think this is kind of gross, but we love doing, is looking at our patients' poop. We were just talking about some of our patients that have been with us for maybe 3 months, and we were looking at when they started, their poop was really like a glob, and now, even though it's improved so much, it's got distinct outlines. It's no longer diarrhea-y. The consistency has improved so much, and that's something we love doing. Even though it is gross, we don't find it gross, and we really love seeing poop pictures. And sometimes we get mad at our patients, like, hey, you gotta upload your poop picture so we know what's going on. If you don't tell us what's going on, we can't give you feedbacks. But our patients, when they work with us directly, they're usually very committed. They will upload everything for us, and that's what we love. Never feel like you are uploading too much, right? We want as much information as possible. And somebody jumped on and said, you talk a lot. You don't have to join on live. I mean, I do talk a lot. And okay, yes. Let's see. I think we also have other questions, but that's the main difference between our course and working with us directly. Working with us directly, I do have to say, because there is the structure, people tend to get better a lot faster because you are meeting with a professional every week. Yes. Okay. Somebody asked, have you seen clients whose symptoms increase around their menstruation cycle? Absolutely, yes, because there are multiple hormones at play. These are normal hormonal changes, right? For those of us who are women, there are times right before our periods where our gut slows down drastically. That's when our progesterone level increases, right? And then and that can cause more bloating, more water retention even, and just more distension and discomfort in general. Now, without IBS, right, most women will experience discomfort right before their period starts. With IBS, it's even more. Now, when period starts, though, there's another hormone that plays into it, and that is prostaglandin. And prostaglandin is a hormone that helps our uterus contract. and shed our uterine lining. That's how our periods comes out. But that hormone, the hormone that causes contraction, can sometimes get to our colon. And when it gets to our colon, it has this effect of our colon, squeezing, having more spasm, potentially causing more pain, definitely more diarrhea. And we call this period poop. And it's kind of normal in a sense, as because there is hormonal changes. What you can do is track your symptoms and see what happens and when it happens to better understand your body and use other tools to help you better manage these symptoms. And what do I mean by other tools? Maybe work on more self-care before your periods happens, or during your periods, right? If you tend to get more symptoms. If you tend to get more backed up, you can use some over-the-counter laxative to resolve the constipation, or maybe even prescription medication from your doctor if you are more constipated over those times. And if you tend to get more diarrhea when your periods happen, you can try out some over-the-counter fiber supplements to help firm up your stool so it's not straight diarrhea. So these are all tools that you can implement. But the key again, right, is to understand your body, knowing what is going on, and then use the right tools to fix it. Don't just throw on random supplements, right? We see people taking random fiber supplements at doses that you probably should not be taking, or random probiotics that make their symptoms so much worse because they don't really understand what is happening. When they're trialing all these things, wasting hundreds of dollars trialing these things. Supplements are not cheap. The ones for IBS, I think they're like $60, $70, $80 per month supply. It's not cheap. Don't waste your money on it. Better understand your body is key to knowing when to use what tool. Use our symptom tracker. So I said pooppedia.org, and on our symptom tracker, I love it because it asks you what day of the month you are for your menstruation cycle. Again, understanding your body is key to resolving your symptoms. It's not blindly trying different things or even cutting out food. It may not even be food related if it's more menstruation or hormonal related. Now, like we said earlier, we kind of act as a caseworker for some of our clients. Sometimes if your period symptoms are really bad, then we may suspect something else overlapping with IBS, right? It could be pelvic floor issues, right? It could be endometriosis. Sometimes we do refer out and we send people to endometriosis specialists. Okay. I hope that addresses the question. That is a really good question. Mm-hmm. I had less symptoms with more variety. Are we talking about more variety of food? Yeah, we really encourage people to eat more variety of food, even low FODMAP, right? Eat more low FODMAP foods when you're on the low FODMAP diet, but don't stay on low FODMAP for prolonged periods because FODMAPs feed your gut microbe. What does that mean? That means it will help your gut microbes be healthier, and you have less symptoms. When you cut out FODMAPs for prolonged periods, it can cause you to have more symptoms. But don't give up. You can reintroduce FODMAPs, systematically to know how much you can tolerate at this time. But the goal is, of course, eat as much of it as you can while maintaining symptom control. Anything else to add to that?
No, I think that was good. Did you see the question about what kind of sport can I do?
Oh, no, I did not. Let me go back to it. That depends. Sorry, that's my kid calling. You can do any type of sports, but I think what it really depends is the intensity of the sports and the duration of the sports, and then also your hydration status, your fueling status. Are you eating enough prior to your sports? Are you giving yourself enough time to digest the food prior to going into the sports, right? If you already have a lot of gut symptoms, you really want to maybe eat lower FODMAPs, things that are easy to digest, and maybe lower in fiber, starting at least 2 hours before your sports. If you're somebody who is extremely constipated, maybe resolve the constipation before you do anything very high intensity, right? Low intensity is always encouraged, given that you are eating enough food to support your activity level and you're drinking enough fluids to So I hope that answers your questions. In our free IBS masterclass, we talked about activity and why high intensity exercises can potentially trigger more symptoms. So that's something you can watch if you're interested. And okay, do we have other questions? Yeah, Gourmet Recovery said, yes, I noticed mine isn't really food related other than broccoli and spinach. That's good. Yeah. Mm-hmm. I mean, broccoli is, of course, can produce more gas, but at moderate amounts, especially the broccoli flowers, can be well tolerated. Okay. And then another question here is, I did a FODMAP test years ago, so I'm guessing that's elimination with reintroduction. Would redoing it come up with different results? Absolutely. Actually, FODMAP tolerance change over time, which is something we talk about a lot, right? If you don't resolve whatever is going on with your guts, if there's irritation in your gut, you won't be able to tolerate much FODMAPs. So the key, again, is really resolving what is going on before you reintroduce the FODMAP foods. And that is, I think, the key part of our program is to use the time when patients are eating low FODMAP to investigate what is going on and come up with the right treatment plan to resolve the root cause of the symptoms. And once that's resolved, our patients or our clients' tolerance to FODMAP improves significantly. And I would say most of our clients can tolerate all of the FODMAP groups, right? Maybe with the exception of one or two groups that they can't tolerate at a higher level. But I would say most of them will be able to reintroduce all FODMAP groups without problem. And once you reintroduce it, that really helps you build up, and then you start eating it at the amounts that you can tolerate. That really helps you build up your confidence that I can eat this. And also why when you read the testimonials from our patients, they say, I feel way more confident about my body. Like treating IBS is understanding your body, knowing what's going on, and then resolve the problem, then reintroduce the food so that you can trust your body in knowing, what causes you symptoms, how to prevent symptoms from coming back. Because if you know your trigger, then you can avoid your triggers to prevent symptoms from coming back. And also having the tools to manage when symptoms do arise, like we talked about earlier with menstruation cycle. You need to know your menstruation cycle so that you know what tools you can use, for constipation or for diarrhea or managing pain, right? These are all things, when it comes to managing IBS for good, it's really learning about your body. It's not about just cutting out food. And we see that so often. So like Gourmet Recovery said, you've done FODMAP challenges years ago. My assumption here is that you didn't tolerate a lot of the food and you've cut them out, right? Am I correct? And then there's another question here, is caffeine and sports don't mix for me. As much as I like coffee, if I drink it before gym, it's an automatic diarrhea. I'm so sorry to hear that. I mean, coffee is a powerful laxative, so maybe go with the lower acidity ones or maybe the caffeine-free ones to see if that helps. But yeah, know your limits. That coffee is one of the tools that we introduce for our patients if they've cut it out for constipation. But oftentimes you have to resolve the constipation first before bringing coffee in, because coffee can trigger more reflux. Not so much diarrhea if you drink coffee and have diarrhea. And if you have IBS-C, there might be something else at play. But of course, we don't know your case, so we can't make recommendations. But don't give up on the food, especially if you like them. Try different varieties. Mm-hmm. Okay, we are approaching our time limits. Do we have any questions? Oh, we had somebody ask what can help. I think what we said earlier, right? Really understanding your body so that you are not blindly trialing things that don't help, because if you don't know what's going on, right? And we hear that all the time. People come to us and say, I've tried everything. Well, whatever you try, if it's not what your body needs, it's not going to help you. So the first step is not trialing all those things. The first step is understanding your body. And that's what we do for our clients as well. Clement's Recovery said, I work out sleepy, then get coffee with food afterwards so it doesn't hurt my tummy. That's good.
There you go.
You know, yeah, there you go.
Yeah.
Coffee is life. For those of you who don't tolerate it, I'm sorry, but don't give up. There is a chance that we can help you bring it back, but I cannot function without coffee. That's me.
No. Yeah.
Yeah. Okay. I think we also have some questions on the Facebook group too. Somebody said, I've been watching what I eat and my gut still, she didn't say still what, but I'm thinking still struggles, puts me in pain. Oh, my gut still puts me in pain. Help. If you are watching what you eat, you know, if you suspect it will trigger, please, please, please work with a dietitian. We do have, like we talked about earlier, right? When it comes to elimination diet, it's a systematic elimination with a it's a structured elimination with a systematic reintroduction. So you're not just cutting things out. If you're watching what you eat, get our symptom tracker, you know, track it for a while and see, and then talk to your provider, because we really don't want people to cut out things, right? So if you're not, here's another thing that we hear a lot. People being recommended the low-FODMAP diet. We know per research, right, the low-FODMAP diet works great. 70 to 90% will report symptom improvement. But if you're not addressing the root cause of your symptoms and you only remove FODMAPs, it makes it extremely difficult to reintroduce FODMAPs, because FODMAPs do irritate the gut if your gut is already very sensitive, right? If your gut is not sensitive, you will be able to tolerate it. So, you know, don't just cut it out. Often we see people cut out FODMAPs, symptoms improve, but they don't bring food back in to their diet. They don't add FODMAPs back into their diets. And when they stay on low FODMAP for prolonged periods, their symptoms will eventually come back and potentially get worse. So don't stay on low FODMAP for a long time. Okay. Any last words? Brooke, you want to say anything?
No.
Okay.
We covered a lot.
Yeah. All right. Well, I do have a closing remark, and I want to thank everybody for joining our session today and for being here and being a part of the IBS community for women in this little Facebook group to support one another. And a special thank you for Ardilex for their sponsorship, which makes this session possible. So thank you, Ardilex, and thank you everybody for watching. We will have another office hour very soon, so stay tuned. Take care, everybody.
Bye.
Bye.